Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, my incredible and knowledgeable nurse practitioner, Rosalind Arp, and I share our combined 30 years experience to guide both men and women as they age. Listen as we dive into a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. These real-life insights are always rooted in solid scientific knowledge. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Hi, everyone. Welcome to the podcast. Today's episode is just a really big, giant PSA to both men and women out there about busting myths about a place that is mysterious to a lot of us, which is the vagina.
So the first myth we're going to tackle today is how we should clean our vaginal areas. A lot of people, the myth is like we need to use special products vaginally, but we really don't need to do that. It's essential to understand that the vagina is a self-cleaning organ, and interfering with its natural processes can lead to more harm than good. Special cleaning products are really unnecessary and may disrupt the natural pH balance or acidity of the vaginal canal, which can lead to irritation and an increased risk of infection. Harsh soaps and fragrances in commercial products can also irritate delicate tissues, potentially causing inflammation or allergic reactions. We typically advise against using these products and using mild soap on the vulvar area only when showering, but never inside the vagina. A lot of these products will say clinically proven, which can be rigorously tested, or sometimes it's just proven in the clinic.
Right. It just means, it's like when it says gynecologist approved. That just means they found one gynecologist that said, sure, this product is fine.
Yeah.
It doesn't carry a lot of weight with it.
Mm-hmm.
So less is definitely more, I agree, when it comes to cleaning the vagina.
Mm-hmm.
The next myth that I hear from some patients is they worry that tampons can get lost inside the vagina. This one's an easy one to bust. The vagina is a tube with only one opening. When you put a tampon in, or anything else for that matter, there is simply no place for it to go but back out. So it cannot, I repeat, it definitely cannot just start floating around inside you somewhere. A tampon can, however, get all bunched up deep inside you so that it might be hard to reach. So if it gets all packed up in the vagina and the string gets tucked up in there, it may seem to be lost, but it is definitely not. You might just need your gynecologist to kind of reach around and fish it out because sometimes it's hard to reach on your own.
Yeah, and sometimes it's you don't know when it came out too. I've had patients who are like, I think I lost it, and it's not in there. So it might have came out.
It might have just fallen out right with your menstrual flow.
Mm-hmm. And then the next myth is every time you get itchy down there, it means you have a yeast infection. That's not true either. Vaginal itching can be caused by various factors, and it's important to recognize that not all cases are due to yeast infections, especially when the itching only happens occasionally or if it's mild. A lot of my patients become very hypervigilant in terms of any itch that they feel. So I tell them, unless you're like stopping what you're doing and scratching yourself away from the public, it typically isn't a yeast infection. Vaginal itching can be caused by other things as well, by bacterial infections like bacterial vaginosis or BV, or STDs or STIs, I mean. Allergic reactions to soaps, detergents, or materials in underwear. Hormonal changes during pregnancy or menopause, dermatological conditions like eczema, psoriasis, lichen sclerosis, or even vulvar cancer. And lastly, sometimes psychological factors also can affect it, like stress and anxiety can contribute to the vaginal itching. So it's best not to self-diagnose because one of the words I said there was vulvar cancer. It's best to see your provider to see if you have any persistent itching happening on the vulva or the vagina.
That's true. And that leads us into our next myth, which is that any type of vaginal discharge must mean that something is wrong. The vagina and the cervix, which is the opening to the uterus, if you still have one, have thousands of glands that make lubrication. You want these glands to be working. A dry and unlubricated vagina is not a happy place. Think of sandpaper or ground glass in the vagina. This is what an unlubricated vagina feels like. Healthy vaginal discharge is clear to whitish to yellow. It should have no odor, or maybe just a similar odor to sweat, when you can just smell a more pronounced body odor. But discharge that is green, has a fishy odor, or as you mentioned, is associated with persistent burning, itching, or irritation, that's the type of discharge that should be checked by your doctor and might signal that something is wrong.
Absolutely. I tell them if you don't have lubrication, that means you're not alive.
Well, unfortunately, there are plenty of people who are alive with low lubrication and they don't like it.
None, no lubrication means it's not, it's like your saliva. That's right. The way I think about it,
you need it your whole life.
You need your whole life, yeah. So another myth that many women get tricked into thinking is something wrong with them if they cannot achieve orgasm during vaginal sex. And I think this is because of pop culture, really, and all the movies. And this is really far from the truth. Most women cannot have an orgasm with vaginal sex alone. One study shows only 18.4% of women reports that intercourse alone is sufficient to have an orgasm. And 30% of women rarely or never have orgasm during vaginal intercourse. And then with that 18%, more than half of the women that do have an orgasm with vaginal penetration, they need to have simultaneous clitoral stimulation to achieve it. So one of the possible reasons for this is our unique anatomy. Some research shows that if the distance between a woman's clitoris and vagina is less than 2.5 centimeters, she's more likely to have orgasms just from sex. But other factors, of course, affects orgasms like atrophy or thinning of the lining, infections, past trauma, anxiety, stress, and in my opinion, your partner's capabilities.
Yeah, if you listen to us regularly, we talk a lot about the ability to have an orgasm during penetration and why it might be difficult. So that's such a common myth.
Mm-hmm.
And here's a myth that has some strange urban legend to it. And this is that you can get yourself drunk using an alcohol-soaked tampon. I had to actually look around for this one because I've only heard it occasionally on social media from younger people. But this type of story has been around since at least the late 1990s, but it is completely false. They've actually performed research to see if an alcohol-soaked tampon can get you drunk. So with the tampon applicator still on, they measured how much liquor a tampon could actually soak up, and they found it was between 5 to 15 milliliters of liquid. Now, a shot of liquor is 44 millimeters of liquid. So the research decided that severe intoxication could not be expected from the dose in the tampon. Now, of course, we don't put our tampons in and then leave the applicator on. So they decided to repeat the study, and this time they saturated the tampons with the applicators off. And tampons did absorb more alcohol, up to 30 milliliters of alcohol. So that's closer to the amount in a shot, but now we run into a different issue. It would be almost impossible to insert a tampon that has been fully saturated with fluid because the tampon expands so much, you no longer can get it in, or you'd be squeezing the alcohol out as you're trying to insert it. So I would say not only is this myth urban lore, it has scientifically definitely been disproven.
Did they check what the proof of the alcohol was, though?
I don't know if they tried it with different proofs of alcohol, but I think overall it's probably a bad way in general to be trying to get a buzz on.
I probably will, though. You know me. One shot, I'm gone.
One small low tolerance.
Yeah, low tolerance. So our next myth is that your vagina will always show symptoms of a sexually transmitted infection. And that is really inaccurate. The majority of the infections I have seen or with patients came in asymptomatic. I found them during routine well woman exams when I used to do gynecology. Many of the STIs can be asymptomatic, meaning they do not cause noticeable symptoms. So individuals may carry these infections without experiencing any of the symptoms, leading to potential transmission unknowingly. And for men, they typically are asymptomatic more than women. So before you enter a new partner relationship, or if you're newly in one, it is really best for you to both be tested. And at least you can start on a clean slate, so to speak.
Right. Just because they tell you they have no symptoms doesn't actually mean they're not carrying an infection. So testing is always best.
Mm-hmm.
And our final myth we're going to talk about is about the hymen or the cherry, or it's been called the bridal membrane. The hymen is the tissue that partly covers the vaginal opening. And people continue to believe to this day that the presence of an intact hymen indicates that the woman is a virgin. In fact, there are whole cultures built around this fact. In many cultures, families are actually brought the bridal bed sheets after the wedding night to look for the blood on them from the breaking of the hymen. And this would indicate that the bride had been a virgin on her wedding night. Nothing could be further from the truth. Some women are born with no hymenal tissue at all, which means there's nothing there to break in the first place when they have sex. Other women have an intact hymen, but it's made of some stretchier tissue, so it flexes rather than breaks with the first act of intercourse. And some women have hymenal tissue that does tear a little bit during sex, but it's such a small amount that there's really not much bleeding, or it's just a little brown discharge, or it kind of gets mixed up with the normal vaginal secretions and doesn't show a blood flow. Finally, there are women who can have a hymen, but it's already been stretched or broken well before the first act of intercourse. And that can happen from them placing a tampon, or during exercise, or during a fall. The presence of an intact hymen just indicates nothing from the standpoint of sexual activity. So that's our final myth that is busted, that the hymen has no value as an indicator of virginity.
Absolutely. And I will tell you, a lot of patients also think that, or a lot of people, not just patients, men, because a lot of men think it's a tissue that really covers the vagina. And it's not, right? I don't know how to explain it, but how would you explain what a hymen looks like?
So if the vaginal opening is oval in shaped, the hymen is not an oval piece of saran wrap covering the opening. It's very often a crescent-shaped piece of tissue at the bottom of the opening. So it just kind of goes around the bottom of the opening rather than covering it completely. You're correct. It's not just like you have to pop through there, despite all of the terms for breaking the hymen that there are.
Yeah. And I always say, I'm like, well, how do you think the blood comes out when you're menstruating if there was something covering it?
Exactly. Right. Things have to, it's a two-way opening. Things can come out and go back in, but yeah, it's one that we've heard people really stress about depending on what their cultural background is.
And the whole like inserting a tampon, I won't use it because I'm a virgin because I don't want to break my hymen. That's not true either.
Right. And I mean, that is so deeply rooted in your culture. If your mother and your mother's mother and so on back have all said nothing can go in the vagina before your wedding night, you may feel that your tampon is doing harm to you. Tampons cannot do harm. I think it's all how we interpret what's happening at the vagina. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.